presentation by Dr. Giselle Cino from Oklahoma State University. Thank you so much for your patience, Doctor. Now I'm going to share your screen presentation on behalf of you. You can start your presentation. Give me a minute.
Thank you so much. And again, take two of this. Let's try it and see if it works. Yeah, thank you very much for everybody for the patience and sorry for the technical difficulties again. Yes, so I'm gonna talk today about Truparella abortus suis in swine farms in the United States. My presentation topic was based basically on a series of cases that we received at when I was back at Kansas State University, and then also during my time at Oklahoma State University. And it's very interesting. I am very interested in the swine farms and swine production. I work a lot with that. And I think one of the most important things that I want to have this presentation as a feedback and as a reminder for everybody, the importance of sampling procedures for abortion cases, especially in major outbreaks, such as the one I'm going to present. Next, please. So Truparella in general is a bacterial organism that is present in many, sometimes it's saprophytous, or sometimes it's present in many organs. There are different types. It was previously known as an Arcanobacterium, and the most common one isolated from lesions in animal species is Arcanobacterium pyogenes. It's a short dipteroid-shaped Coccobacillus. The picture that we have there on the right is the pyogenes specifically, and on a culture cytology. And this organism is a Coccobacilli, so they are fairly small and tend to cause multiple infectious outbreaks in animal species, especially in naive herds. And when this was classified as a Truparella back in the early 2000, I believe, or in the early 2010s or so, this was included several other pathogens, but however, Truparella abortus suis was not recognized until 2009. Next, please. So Truparella abortus suis is shown in this first report of the organism by Azuma and all of the co-authors, which is a Japanese actually author. So the first isolate of Truparella and the first report of Truparella abortus suis organisms, or Truparella abortus suis murakami, was in Japan. And the Japanese actually showed this organism and isolated. And as you can see in the image in there, it was classified as an Arcanobacterium abortus suis murakami type specifically. Next, please. So where has it been isolated? And you can just click on there so I can show it in the map. So like I mentioned, the first report was in Japan. And so the star that will show, if you click on the presentation, please, it will show Japan in 2009 first. Then there was an isolation in Spain and Germany. Almost simultaneously in semen boards, especially was isolated. However, in those, there was no report of a massive outbreak of abortions in this animal species, in swine species. And then also after that, there was some isolates in, like I mentioned, in Spain, also in the semen boards that were non-pathogenic, not clinical signs or no lesions whatsoever. And also was isolated in the United States, and the report that I will talk about was in 2017, the very first one. And the next one was in United Kingdom, that was just recently 2021 that was reported. Next, please. So Japan, next, please. Spain, next, please. USA, and next, please. Germany, and United Kingdom. Thank you. So like I mentioned, it was first described in Japan in 2009. This is just a screen of a shot of the paper where Murakami, Ozuma, Owada, Akada, Miyazaki, and Makino were the ones that reported it first, just as an isolated in an abortion case in Assau, and it was a case report. And that at that point, it was a novel species isolated. So there was no reports of this type of bacteria with abortions or whatsoever in animal species, especially in sow production. Next, please. However, in the United States, this was isolated, like I said, in some boar semen and in some other cases, but never reported in abortion cases. Next, please. And other publications I mentioned, the one to the left is the German publication that mentions the isolated of this organism in pigs in Germany, associated with, in this case, potentially emerging pathogen of abortion in swine. And then also the United Kingdom one to the right that was just reported in 2021 in May. Next, please. And the one I will mention, which is my publication with my collaborators that describes the abortions in the United States. Next, please. So the case study in the United States is a series of 3 specific and different outbreaks. They started in 2017 and went all the way to 2020. These were in multiple sow farms. One of the biggest ones that was affected was a sow farm in Midwest that had about 3,500 sows and about the same number of gilts. And the same farm was an all-in, all-out type of sow farm, sow gilt farm, with using artificial insemination in the south. And I actually got the opportunity to visit that farm and perform some testing on these animals and some necropsies. The next case, that was the first one that was reported in 2017 early. In December and November and December of that same year, in 2017, there were another case that was reported also in the Midwest in the United States. And then in 2020, there was another one in the Midwest as well. So I am part of the swine organization here, and we have a recent, in the list serve of that swine organization, we had a recent question arising from a researcher back in a university in Midwest as well, in Midwest of the US. And they are asking, because they were isolating Trupperella abortus suis in multiple swine abortions from different sites. And they were asking if that was heard. At that point, the paper that I mentioned to you wasn't published yet. So interestingly, I got in touch with that person, I believe, and we talk about that case. But interestingly, that was also an isolate that was just last year, 2021. That was not included in the publication. So there's no data as to what farm, what kind of type of sow farm they showed and what specific clinical signs were present. The only thing is that there was an abortion rate increase and recycling of the sows and the gilts. One interesting thing about this also is that Trupperella abortus has been present in other animal species. I didn't mention that, and many times associated with skin lesions in humans and cattle and dogs, and also with systemic infection in animals that are immune suppressed. And I mentioned that because when we performed the testing and did all of our investigation, especially in the case that I visited, we were not able to find any potential causes of immune suppression in these animals that could have led to this pathogen being isolated and in the different tissues and in this animal species. Next, please. So the picture is not from my particular case. I was not able to obtain any pictures of the case itself, but this is basically just an example of what we saw when I visited the farm in the case that I was working at. So basically, the the animals that were affected we did not present major clinical signs. So the sows and the gilts particularly were not clinical. They did not have any major disease type of clinical signs. So there was no fever. The animals were feeding, eating, drinking, alert, and acting normal throughout the whole process. They also did not show loss of appetite or weight loss whatsoever. The only clinical signs and reason for the complaint in these farms was the fact that these animals were having a conception rate decrease of about 12% at about 30 days of gestation, which is kind of like a major decrease in the gestation rate for these animals. So 12% abortion or 12% loss of embryos in swine production is quite a bit. If you imagine and think about these animals having about 16 to 20 something piglets per litter, that's quite a bit of animals that are being lost at the same time when you have a 12% of animals affected. The abortions were mostly occurring about 40 to 50 days of gestation. So they were kind of like in the early stages and or middle stage of the gestation. And then many of these animals, especially I saw that in the gilts were having repeated cycles. So about 30 days of gestation or 35 days of gestation, or they were supposed to be getting pregnancy checked, and they were recycling. And so that was one of the major clinical signs as well with these animals. And then the few animals that have any clinical presentation, any clinical evidence of a problem were, of course, those animals that have secretion in the vulva, which is the picture that I'm showing. And so what we did with these animals that have secretory exudate from the vulva was we sampled those animals and we use them for the diagnostic testing, which is what I am going to talk about next. Next slide, please. So the performed assays for each of those cases included bacterial cultures. We performed necropsy on the aborted fetuses and the placenta, and I was able to perform necropsies on a couple of the sows as well. And then metagenomic analysis was performed as well. Overall, the samples collected were very important in order to reach a diagnosis, and especially with the case 1, that was our very first presentation with a major rate of pregnancy, repeated cycles, and pregnancy failure. So we have a lot of samples that were collected in these animals. We did about 50 uterine lavage fluids and vaginal swabs. Semen samples, of course, you get a stock of semen samples, and they were testing them every time they will get a new stock of semen in the place. They did serum samples, paired serum samples on about 19 of the clinically affected animals. And so out of those 3,500, there were about, I would say, I cannot remember, about 20 or to 19 animals that were affected. That's a number in there. And then they also did a bunch of environmental samples, because one of the major issues, it was that this farm, one of these farms, especially case 1, had no contact except for the semen and the feed samples received. They did not have any contact with the exterior world. So the major issue was knowing where these organisms were coming from in order to avoid. So they were sampling the hands of the persons and the person performing the artificial insemination. They were testing the gel, the lube, testing the artificial insemination probes, the semen, the feed, the water sources, everything in the environment as well. So we did a lot of follow-up in that particular case. When we got to case 2 and 3, we got a little bit more knowledge, and so we did a more focused sampling, and that's what I'm going to talk a little bit about as well in this case. Next, please. So for the testing performed, we did the testing on all the major common aborigenic causes of swine. Did molecular testing for PRRS, of course, PCV2 and in the case of the one, we did Seneca Valley virus testing because the animal is there was an outbreak of Seneca virus in the farm previously, so they wanted to make sure we checked that and we're not associated, although there's no true association of that or causation of that. And then, of course, leptospira PCR testing was performed in multiple tissues. And these tissues were just done in the aborted fetuses. And then the serology was done in the serum from the affected, positive, isolated animals. So at the same time that we did the molecular testing on the tissues, and some of the female tissues that we collected, such as the placenta or the uterus, we also did the aborted fetus workout, which is at the bottom on that list. And the aborted fetus is workout and doesn't include all of the testing we did here, but basically we do PRRS, PCV2, lepto cultures, lepto PCR, Brucella suis, on the stomach content. We did fetal intracavitary swab because the fetuses were very small, so tissues were difficult to identify in many of them. So we just do a fetal swab, and then placenta, as well as intrauterine swabs and intrauterine lavages, which of those two of them, in my personal experience, intrauterine lavages was the best sample. We actually use an artificial insemination probe to perform the lavages of those animals, and that yield less contaminants. So that's a very important take-home messages for those clinicians that are going to try to work in abortion cases. And if you think it's a bacterial, especially if you see a bacterial suppurative purulent type of exudate coming from the vagina, from the vulva, make sure that use the a lavage in order to get those organisms less contaminated. For me, at least in my personal experience, it was a much worth it sample collection method than doing just a swab on the vagina or in the cervix if it is opened. And then serology, as I mentioned, we did serological testing on those 19 animals that were positive for Trupperella aborigines to make sure that they did not have lepto titers or porcine parvovirus titers. Next, please. So the histopathology, of course, I'm going to talk about that because I am a pathologist, so I cannot go without it. But histopathology of placenta tissue showing here reveals a very severe placentitis. There was a lot of suppurative material with tons of bacterial organisms in there. As you can see in the image to the left, that's the placental tissue, and it's just completely thickened by this membrane that is covering with dead neutrophils, etc., and a lot of edema. Next, please. The uterus of the affected sows and gilts also reveal intrauterine infection. So there was also an endo or apiometra in this case. Next. And within that isolations, we found the gram-positive coccobacilli organisms consistent with Trupperella aborigines. Next, please. So the take-home messages for my presentation. So we always should consider Trupperella aborigines as a potential pathogen and differential in case of abortions in swine species, especially when there is vaginal discharge or abortions early or middle gestation in which the animals are showing some clinical signs of pyometra. We had a lot of luck that in our cases, we were able to isolate using the bacterial cultures in the MALDI-TOF, and then also with metagenomic analysis. But another important take-home message is that a full abortion workout needs to be done every time there is an abortion storm in any farm, and that includes fetal tissues, include placental tissues, and includes also abortion, necropsy on the sow, and potentially some environmental samples, especially in terms of the semen, and in terms of the feed, test for the multiple other things that could potentially lead to the abortion. And I did not mention this, but in terms of testing, we also tested the sows for presence of minerals and especially selenium, vitamin A, vitamin E, and D, especially, which are very important in terms of the immunity for the animal. So these microelements and macroelements usually play a very significant role in the immunity of the animal. And so when there is lower levels of those, usually you need to start checking them to make sure that there is no decreased amount insufficiency that leads to immune suppression and susceptibility of these animals to this potential bacteria. And then, like I said, in ancillary testing, many times what happens, and I don't have a lot of issues with that, but with farmers, and especially if we are dealing with farmers that have a little bit of decreased cost in the or a decreased ability to spend on testing for their animals in different labs, it can be a little challenging to perform many ancillary testing. They just may want one or two tests. So that's very important to link the ancillary testing with what tissues are submitted to the clinic, to the laboratory. So important that the two of them are linked. So if you want to perform bacterial cultures, make sure that you include organs that are important for the septicemic abortions or bacterial abortions in animal species, such as the lung, the liver, placenta. Obviously, the placenta is one of the most important tissues that, incredibly so, is not included with abortions. Maybe because many times by the time the clinician comes to see the animal, the placenta is no longer available as the mother has, gotten to it or it disappears. So placenta is one of the most important tissues that is sometimes overlooked or not submitted for testing, and can be very important for isolation of the organisms, especially when you have such a severe placentitis as I showed you. And finally, the investigation needs to be done in terms of what is the role of this organism, this pathogen, with swine abortions and reproductive failure. So far and to date, what we know is that we have isolated this organism in these cases, that they are abortion cases. The organism is present in the different tissues. In fact, only one of our fetal samples that we collected and did histopathology had pneumonia, bacterial pneumonia with organisms in there. And that was on case 2. And then the placenta, of course, that many of the animals had placentitis and endometritis, right? But important that we need to learn more about this organism. And so many studies has to be performed in order to continue to learn what is the outcome, if this is a pathogen that is primary or is a secondary pathogen that appears after something else changes in the microflora after you use the insemination or whatever in the cell, and then it leads to the bacterial infection. All right, next please. So I want to acknowledge all of my co-authors, especially Dr. Sport, Luber, Stokak, Walensky, and then also Dr. Chengapa that helped me with bacterial interpretation. Kansas State Laboratory for assistance with the multiple testing that we performed in our case, especially in the many of those were performed at no cost, just for the sake of the investigation. And then the family at OEDDL for allowing me to give this presentation and to participate in this seminar. Thank you very much, and I am open to any questions and also comments.
Thank you for that insightful talk, Doctor. Now the stage is open for questions. I assume that you have no questions from the speakers, Doctor. Once again, I thank you for being a part of this webinar and hope to associate with our future events in person. Thank you so much and have a great day.
You too. Thank you.
Once again, I thank you all for making this webinar a huge success and hoping that our association continues for further events. If you have any queries, please write back to your program manager. We are closing the session now. Thank you.